Today, I'm going to share with you one of my favorite hacks for relieving pain. The way this one works is going to blow your mind. But before we get started, let me introduce myself. My name is Dr. Brandy Rose Lipscomb. I'm a naturopathic doctor here at Essential Wellness in Arlington, Washington. And pain relief is kind of my thing because on the side, I run an entire online program that is devoted to pain relief called My Pain Eraser and Rapid Recovery. And our clients go through a pretty extensive application process first to make sure that they're a good fit. And if they are, and we get the letter of medical necessity and the things that we need to be able to work with people from different states, then my clients get to become a proud device owner of a device called the First TX. And the First TX is our dynamic neuromodulator. And what we're talking about is a device that sends in parasympathetic shaped waveforms and reads impedance every 2 milliseconds in order not just to relieve pain in the local area, but to actually communicate centrally and activate the brain's awareness of the issue and start to stimulate the body's ability to heal itself. They also get all kinds of fun attachments and things that go with the device, along with my extensive video library that walks them head to toe through all of the different ways that they can utilize the device with the modes and the frequencies in order to get the best results out of the device and out of the program. But I never put all of my eggs in one basket. You know, I think that especially with chronic pain, I want to come at chronic pain from every single angle I possibly can in order to get people feeling better as soon as humanly possible. And so one of those little tricks, little hacks, little outside of the normal realm tools in my tool belt is a little known substance called LDN, which stands for low-dose naltrexone. Now, when I say naltrexone, most of you are probably thinking somebody with alcohol addiction or drug addiction, like an opiate addiction. Heroin addicts are often given naltrexone because naltrexone is an opiate antagonist, meaning that it binds that opiate receptor site and it prevents opiate type pain relief from actually being very effective. So if someone is trying to get high on heroin or fentanyl or some kind of drug like that, it blocks the effect of those drugs. Now, that's when we take it in 50 to 200 milligram doses. But low-dose naltrexone is a completely different thing. It is a compounded medication that your doctor has to prescribe to a compounding pharmacy where they're familiar with how to make low-dose naltrexone. Because what we found is that when you give someone tiny doses, like we start at 1.5 milligrams and typically work our way up to about 4.5 milligrams, that low dose sort of grazes those opiate receptors, lightly stimulating them or blocking them, I guess you would say, which in turn creates an effect of stimulating those receptor sites and upregulating the body's production of its own endorphins, bradykinins, and enkephalins, our feel-good neurotransmitters that communicate with our immune system and our nervous system about how we need to function. What happens is we take the low-dose naltrexone and you get an upgrade. Research shows up to 4 times the normal amount of endorphins can run through someone's body in response to low-dose naltrexone, and that creates beneficial effects within the immune system and the nervous system. So low-dose naltrexone is used for conditions like fibromyalgia, multiple sclerosis, autoimmune conditions, chronic pain, and several other conditions in that realm. It is some of the benefits of taking low-dose naltrexone include improved mood and overall sense of wellness. It's even been used to kind of reduce cravings and help with weight loss. It's been used to help correct autoimmune conditions and to relieve chronic pain. And despite the decent evidence that's out there to support these findings, the FDA FDA still does not consider low-dose naltrexone as its own labeled drug or as its own use. So all of this is considered off-label uses of naltrexone. What are the side effects of low-dose naltrexone? That is a great question. So some users will notice an increase in overall kind of soreness or fatigue or that feeling of muscle soreness when they first start low-dose naltrexone. Maybe 10% of users that can happen to. And that is why we typically start with a really low dose of like 1.5 milligrams and get used to that for a week, and then bump the dose up a little bit the second week. And then by the third or fourth week, we've worked our way up to about 4.5 milligrams a day, which is where most people stay on that prescription. And this is a drug that you can easily stay on for long term with no harmful side effects to your kidney, to your liver. The only real side effect that is worth mentioning is that if someone is on opiates and using something like hydrocodone or Percocet already for pain relief, that the low-dose naltrexone is going to make those drugs less effective. And so, if someone is relying on opiates at this time, low-dose naltrexone is not the greatest therapy. But someone who just got diagnosed with an autoimmune condition and is having some joint pain and they want to get ahead of it before they become crippled by, the autoimmune condition, great time to utilize a drug like this. Or someone with fibromyalgia or multiple sclerosis who has waves of pain that may come and go or may shift and change, and they're not using opiates. Great time to see if low-dose naltrexone is something that's going to be of benefit. Most people need at least a full month to 2 months of being on low-dose naltrexone before they really see the full effects of the drug. And it's something that a lot of people don't even realize how well it's working for them until they say, that's not doing anything. And they stop taking it. And then they feel, oh, that's right. This is how I felt before I started taking the low-dose naltrexone. Sometimes it's a subtle effect. Sometimes it's a mighty effect that we get from this tiny little dose of this interesting drug. What's great about low-dose naltrexone is that it only costs around $30 to $40 a month from a compounding pharmacy. Now, finding a doctor who is familiar with the research on low-dose naltrexone, how to prescribe it and where to prescribe it to might be a little bit tricky. So I'm going to leave a website in the description below that will give you some resources and a place to kind of start your own research if you're interested in finding out more about LDN. So I want to be perfectly clear that this one little medication is not going to eliminate 100% of your pain immediately overnight. I wish it would. I wish there was something that would, but that's not always the case. It's usually the case of, well, that low-dose naltrexone helped me feel 20 to 30% better, and then this supplement over here helped me feel another 15 to 20% better, and then avoiding those inflammatory foods helped me feel another 50% better, and getting this exercise and that stretching and then maybe this medical device, right? You see where I'm going? It takes an entire comprehensive approach, working with the body's own production of its neurotransmitters, working with pain relief devices. So don't expect, one dose of low-dose naltrexone to be all you ever need to feel 100% better in the world. But it is an interesting approach that is not that commonly known in the US. And so that's the reason I thought I would bring it up and share it with you guys today. I really enjoy giving you information about things that you don't find in your traditional medical doctor's office all the time, and you wouldn't know to ask for it if you weren't tuned in to our channel. Speaking of tuning in, if you haven't yet, hit that subscribe button and the notification bell in order to make sure that you're notified every week when we release our fresh new content. Please make sure you do so now. So what if that little dose of low-dose naltrexone is not enough to relieve your pain? If you click on See More in the description below, you'll find the link to the My Pain Eraser and Rapid Recovery Program webinar. You have to register for it, and there you get almost an hour of information that describes exactly how this device works and exactly what you get inside the program and exactly exactly how to apply if it's something that you're interested in doing, to see if you want to work with us. And if you're interested in finding out more about our program and you want to check out how this device works before you dive into the webinar, make sure you check out this video on the 5 ways that this medical device outperforms TENS. And if you're interested in seeing a demo of how we treat a bone-on-bone knee inside our program, this is definitely the next video you need to watch after that. As always, we wish you guys optimal health and happiness. Thank you so much for watching, and we'll see you next time.